Okay, we're in Jessica.
Okay. Okay, thanks everyone for joining us today. The Borough President will be a few minutes late. So I think we will get started. Shula, you're gonna help? Yeah.
Thanks so much, everyone, for coming in. Today's task force will focus on pediatric health and the city's ongoing efforts to vaccinate all New Yorkers, including those most recently eligible, children between the ages of 5 to 11. We're honored today to have joining us Dr. Anthony Lim, the head of pediatric emergency medicine at Mount Sinai. Dr. Lim's research focuses on the multidisciplinary care of children with acute illness and injury, care coordination across multiple platforms, and healthcare resource utilization. And much thanks to Brad Korn and Mount Sinai for helping to connect the task force with such experts as Dr. Lim and his colleagues. Dr. Lim, we're happy to have you talk about whatever you want. But just as a starting off, could you please explain to everyone what a pediatric emergency room is and how it might differ from a non-pediatric ER?
Yeah, thank you so much for having me. I really appreciate your time and the honor of speaking to the group. So I'll start off with the differences between a pediatric ER and a general ER. In general, there are several scattered throughout the city. In general, pediatric emergency departments are geared towards the care of children and their families. They tend to have the resources, the staff, the training, equipped to manage children from time of birth all the way till 18 to 21. Some of our pediatric emergency departments in the city will go up to age 25. And so I think it's a fantastic sort of setting for children and families. Certainly I'm a proponent of making sure that every child in our city is seen and taken care of by folks that are most and best equipped to take care of them. So I'm proud to be part of that group.
Terrific. And thanks so much. And also, I know that Gail's mentioned in previous meetings that we actually have a piece of legislation that's active within the council with Councilmember Brandon that would require the city to not only maintain, but also distribute a list of all the pediatric emergency rooms in the city when a child is born, and also through children's programs and schools on an annual basis, so that parents would have information if they do, even within emergency, have the ability to make a choice based on that, that they could avail themselves of all the services and amazing staff that you and your colleagues can offer. So I guess to the next thing within this realm, I guess the big question is how is COVID-19 impacting the children and families that Mount Sinai serves? If you could tell us more about the pediatric COVID cases, and are families more or less likely to go to the ER during the pandemic thus far?
Yeah, I think, thank you so much for, having me spend a little bit of time to talk about how COVID has impacted pediatric care. And I think it has really gone hand in hand in how COVID has impacted, adults and our families. It's striking that for a respiratory illness, this has been something that has not primarily or predominantly affected young children. We often see, things like RSV, which is very prominent right now, or flu, be something that's really prominent in amongst children of school age. But for one reason or another, this seems to be something that has more greatly impacted, other parts of our community. That being said, I think the impact on children with regards to the loss of school, which is a significant impact, with the loss of family members, with the loss of economic and social support, has been really important. With regards to medical care, we have seen, just like other centers, children that have had COVID, have required respiratory support, have needed to go to the intensive care unit. And so while it is a smaller impact than in adults, there is still an impact of COVID. And that is why vaccinations, are something that is giving us so much hope. In addition to that, We have seen, of course, cases of multi-system inflammatory syndrome in children, which is this syndrome that occurs about 4 to 6 weeks after an acute case of COVID, where children will develop persistent fevers and, most importantly, can affect their hearts and cause myocarditis. Again, I think that, knowing that COVID is now potentially a vaccine preventable illness is something that gives us as pediatricians, as emergency medicine specialists, real hope that it will allow our children to return to some new normal, whether that be back to school, the ending of quarantines, those sorts of things. And so that's why we look towards this vaccine rollout with so much promise and so much support.
Terrific. I'd like to open it up also to members of our task force if they have any questions for Dr. Lim.
I guess I would just jump in and talk about what you've seen in terms of, hesitancy and how families have embraced or not embraced the vaccine, especially among younger children, any particular impacts of the vaccine on children, that kind of thing.
Yeah, so, what I'll say is that vaccine hesitancy when it comes to parents having their children vaccinated is certainly a bit of a different animal than the choices that parents and adults have made for themselves. I think that what is sort of important is that we address parents at where they are. We are, as soon as and even before the vaccines rolled out, we've been in ongoing conversations with schools, with faith groups, with all sorts of stakeholders in the community to talk to parents and talk to their loved ones about the importance of getting vaccinated. I think the hesitancy with many families centers around the potential benefit or lack of benefit of the vaccines, especially in the pediatric population, as well as the general sort of concern for side effects from it. So to touch on the first part, I'll say that the medical impact of COVID on pediatric patients is certainly much less than in adults. I think that the benefit of the vaccine is in the fact that it can save us and get us back into schools. I think that ending of quarantines in vaccinated individuals, the decrease in the number of cases, and the potential to return us to a more normal educational environment is really where that benefit is. In addition to the health benefits of not getting COVID, not being isolated for 10 days, not having secondary cases in your family. And then of course, there is this large group of underserved and susceptible children in our community with chronic illnesses that themselves are of course susceptible to the complications of COVID. Secondly, the rates of complications from vaccinations have been exceedingly low. In the trial that resulted in the approval of 5 to 11-year-olds, there were no cases of anaphylaxis in the group of subjects that was vaccinated. There were no cases of myocarditis within that group either. And the general side effects were actually, about 40% of the kids with mild, sore arms or fever, which is actually a lower rate than what we've seen in adults. And I think the outcome is certainly true. Like there were 19 cases of COVID in this group of 2,200 participants. 16 of them were amongst children who were not vaccinated. 3 of them were amongst a group of children who were vaccinated. That's where they got that number of 91.5% efficacy. And again, so I think it shows similar promise to what we have seen in other age groups. And now as tens of thousands and more children are vaccinated, we continue to collect that information, and it helps inform us and, more importantly, reassure us that this vaccine is indeed safe, effective, and I think will really have a long-lasting impact in getting us back to, again, a new normal.
That's great, Dr. Lim. And looking forward also, what do you see in terms of when, I don't know it's necessarily the next group, but 4-year-olds and under, when they might be eligible to have a vaccine?
Yeah, I suspect that the next group of children that will be up for emergency use authorization will be the 2 to 4 year olds. When they collected participants for the Pfizer study, they collected in groups 6 months to 5 years old, and then I'm sorry, 6 months to 4 years old, and then 5 years to 11 years old. And so what they may end up doing is releasing that 2 to 4 year old data next, which might then clear a large population of children that go to daycare, while they hold off and collect more data on the 6 months to 2 years old. So I would think if that data came out in December or January, we may be looking at vaccinating at least the 2 to 4 year old kids in the late winter, early spring. So we'll be back at this again and rolling out to another group of probably happy parents and maybe less happy kids.
Maybe as long as there's really good Band-Aids available.
It's true. I mean, as an aside, having helped with the rollout of our vaccine pods for 5 to 11-year-olds, we went through a lot of preparation and making sure that our vaccine pods were child friendly, a very positive and happy and supportive atmosphere with really prepared nurses, child life and music therapy, because we're really mindful. This is a 2-shot series. If you don't have a great time on your first shot, we're going to see you back in 3 weeks, and it's going to be a little bit more difficult. So if the first one ends up being a really positive experience, that helps us, along the way. And again, I think anecdotally, many of these 5 to 11-year-olds, they're smart kids. Like, they've seen their big brothers and sisters get vaccinated. They've seen their parents get vaccinated. And if it's a bit of a note to say that when parents are really positive about their experience, and when their older siblings have had a positive experience, they've been able to go to camp this summer, they've been able to go to school full time without any side effects. The 5 to 11-year-olds really came into their vaccine appointments looking forward to it. So, that first day we had 50 vaccinations. I'd say maybe 2 or 3 really needed like hands-on, like, music therapy and child life, and the rest were really happy kids.
Perfect. And I think, again, underscores the expertise and thoughtfulness that pediatric doctors and emergency room doctors really bring to the table. We're so appreciative of your time with us today, Dr. Lim. Are there any other questions anyone wanted to raise? That's great. Well, I think in advance, we'll ask you if we can see you again another time. But thank you so much again for your time. And Brad, thanks again as well.
Absolutely. Thank you guys so much for the opportunity. And again, I'm at your service. Thank you so much.
Thank you. And Borough President Gil Brewer has joined us today.
Yeah. It's very hard to because I'm in the car, so I think you're doing fine. I assume that you're going to have either the great Chelsea Cipriano or Laura Atlas on next. Is that correct? I can only tell from your notes here. So.
That is correct. Our very next guests are both the great Chelsea and the both great Laura, who are going to be joining us from Department of Health and also the Vaccine Command Center. One of the things that Laura very kindly joined us last week to talk about was the mayor's school-based vaccination efforts. And we talked a little bit how that was going on the ground, but also there have been some exciting, I think, updates on how that's being expanded, really because there's so many parents who are, very excited about actually having, their children vaccinated at the school that they're going to each day. So I'll turn it right over to Laura and Chelsea, who can hopefully share with us how things are going and also what the plans are going to be for the next week or next couple of weeks.
Yeah. Hey, everyone. Thanks again for listening in. Thanks, Shula. Thanks, Borough President. Indeed, lots of exciting news today on the school-based vaccine front. A couple of things. We put new dates on for Wednesday and Thursday. They're on the DOE website for schools where we saw particularly high demand. We want to make sure we can get to those folks again. I just dropped the link in that DOE publishes. This has all of the sites where they will be. They're broken up by borough. You can see the date, you can see the times. We also announced that we will be going back for second doses. This is a big question last week. Are we going to go back for seconds? Yes, we are. We are also in between first and seconds. We are going to all charter schools that are in private locations. These are not the co-located charter schools that are in public school buildings, because they can use the vans and the mobile units that were sent to those schools. So everyone, the idea is that everyone should be covered by the end of this in the charter and public school universes. That said, also, if you realize that you're one of the schools that's going to be getting second doses and you are not a part of the first dose tranche, please feel free to go and get a first dose when we are doing second doses. That's totally fine. The one caveat is that we may not be able to go back for second doses in a round 2, but all of that is to say that there is plenty of availability here. This also means, though, I know you guys love to work with our mobile teams and request them for various events that you're having. All of our mobile teams are at schools until further notice. So please just, be patient with us when you're requesting things. We'll try to do what we can. We still have testing that we can send out to events, especially the microsite teams. But in terms of school vax, that is going to be the majority of our pipeline, at least until early December. On that note, happy to take questions about it. And I know Chelsea also wants to talk about boosters.
Yeah. Hello, everybody. Sorry, I don't have a camera on this computer, so I'm going to be a faceless voice today. Let's take a pause, Laura, and let's do questions for you about school vax or anything upcoming, and then I'll do boosters.
That's so great, Laura. And Chelsea, thanks so much again. I think just 2 quick questions following up on this really exciting expansion, which clearly there's so much demand for. In terms of the second doses for students who have already received their first dose, how will parents be notified of when that will happen?
Yeah, so similar to the way that the first doses work, the schools, we're basically going to repeat the schedule that we did the first time. Now, remember, there's a couple of peculiarities here because last week when we started, there was Veterans Day on Thursday. So we didn't have vaccinations at schools that day because nobody was in schools. So the calendar will probably adjust for that a little bit, but I imagine more or less it will repeat at the same cadence. Now, that said, we're going to be relying on what principals are telling DOE, telling superintendents. That will inform how we're doing this. We're going to try to make sure we can get every single person who wants a second dose, we can get their dose to them that day. We'll try to make sure that every person who wants a first dose, we can get to them that day. Of course, there's a lot of logistics at this point. We're doing well over 200 schools a day, and the teams have to swap, right? They start in one place in the morning, they go to the next place around noon. So there is a lot moving around every single day. And so, there will probably be some hiccups here and there, but again, we're going to try to get to as many people as want to get vaccinated that day.
Terrific. And I think one other thing that was mentioned last week too, and I mean, you mentioned, for example, that the mobile vans that are doing vaccinations, those teams will be transitioned, or assigned right now to schools. Is this impacting at all the in-home vaccinations that people can request as well?
Yeah, so it will have an impact on that. We'll be able to do it we're still going to be able to do that. People should still call if they're interested in in-home vaccinations. You can get an in-home vaccination for any of the shots, right? Moderna, Pfizer, Johnson & Johnson, whatever you want. It can be any dose, first, second, third, if that's what you're interested in. And we're going to be adding kids to that as well, kids under the age of 12. That said, yeah, this is definitely going to have an impact on that pipeline. It may be a little bit more delayed just because we do have teams who are deploying out to schools that formerly were detailed out to at home.
And just a quick reminder, because I think in-home has gotten a little buried recently, you can get your $100 if it's your first shot through the in-home program. I think a lot of folks don't know that, and it's always a welcome surprise. So that is still available.
And kids get $100.
Yeah. At the school sites. Yeah, good point.
A good point for sure. Maybe before we go to Chelsea, does anyone have any questions for Laura? You can either just unmute yourself or put them in the chat. Okay, so maybe Chelsea, Laura, thank you so much for that update. Chelsea, let's kick it over to you on boosters.
For sure, thank you. And I will say real quick on kids stuff, if anyone wants to help promote kids vaccine on social media, not just the school stuff, but general, getting kids vaccinated, particularly the newly eligible group. We have tons of social media assets. Our teams, both Laura and my team, have been working really collaboratively on getting all types of messaging out there. You may have seen the little Statue of Liberty with like the mom Statue of Liberty. It's very cute. Let us know what you need. We are here to help give you the materials to amplify with your own networks, but we have lots of stuff. So if you're feeling like your social media presence needs an uptick of kids vaccine content, we are here for you. Anyway, maybe just me. Thanks again for having me. Hi, everyone. It's Chelsea from the Health Department. I am going to do a quick update on boosters. Folks may have seen yesterday that the commissioner issued a commissioner's advisory, which I'm going to drop in the chat. Essentially, the advisory says that providers should not turn away any patients if they request a booster, and they should reach out proactively to their patients who are 65 plus, people who have underlying conditions, or receive J&J to get a booster. So essentially what this means is get a booster. No one will be turned away. You must be at least 18 years of age, and it must have been, of course, 6 months since your last dose of Pfizer or Moderna, or 2 months since your last dose of J&J. But if you fall into those categories, you can come get a booster at sites across the city. And the commissioner's advisory is essentially telling providers, you should not turn people away if they request a booster. So that's the booster news. The advisory is in the link. More information is on our website about this. So I know there have been lots of questions, and I hope that if folks on this call have tried to get their boosters today, they have been able to do so. Thanks.
Chelsea, thank you so much. 2 quick things on that. If you can, I'm sure it's in this excellent PDF that you just shared with us. But could you I think one of the questions that comes up a lot is about mixing and matching, or if one should stick in
Yeah, no, absolutely.
Did. And then also, you really sold, I think, that Statue of Liberty as mother type of. So I'm convinced at least. So if you also maybe could share with us via email any of those things that we could then share out with the rest of the group, that would be great.
Yeah, absolutely. I'll make sure you guys have the social media kit and all those assets. They have multiple languages, and it is very cute. On mixing and matching. Whoa, having trouble saying that today. Yes, you absolutely can mix and match doses. I'm going to put in here an FAQ, a couple FAQs. It's on this main page that I just added in, but essentially FAQ is about, if you've got Pfizer or Moderna, or you've got J&J, what you can and should do. You can get a dose of the other vaccine. It doesn't need to be the same vaccine that you received. So if you, got a Moderna vaccine and you want Pfizer as your booster, you can do that. We say try to get the same vaccine for your booster shot, but you are able to choose any of the 3 vaccines if you got the Pfizer or Moderna vaccine. So that's all in the documents that I'm dropping here. Sorry, I'm trying to multitask, but failing. And these are also on our website if you want to, share them with folks. I'm also going to drop in a link to the FAQ that we have about the difference between boosters and third doses, because I think it's getting a little bit lost in the narrative that if people are immunocompromised, so they need a little bit extra, not just like a booster shot that all of us are getting, but an actual third dose of a vaccine, which is fairly common for people who are immunocompromised to need an extra dose of a vaccine. People should still be getting that third dose. That is, it's the same shot as the booster, but it is still recommended for people who are moderately and severely immunocompromised. So I'll drop that in too, and you will have all of these documents at your fingertips.
Thanks so much, Chelsea. And I think one other thing that we've gotten just as a practical question from folks and maybe this is kind of like, when we were looking at first doses, one of the recommendations that seemed to be was that you should not get a dose at the same time of the COVID vaccine, at the same time that you are also getting another type of inoculation. Although I know myself, I just signed up for a flu shot and they asked me at the same time, oh, would you like any of these other vaccinations? And I said, Yes, thank you so much. So could you
Yeah,
address that really briefly too? Like,
sure.
is it okay to knock off your flu shot if you haven't gotten it yet, or anything else at the same time?
Yeah, it is. It is okay. You can get your COVID vaccine before or after or at the same time as any other vaccine. And everyone should, of course, get the flu shot this year and every year. I will also drop in the chat, our vaccine facts page. And if I'm remembering correctly, there is an actual question on there about this explicit thing. So if folks, are looking for this language or have a friend who just don't believe them, they can send them this website. Though if your friend doesn't believe you, I'm not sure they'll believe me, but we like to try.
I think it's all worth the effort. We have a question from Katie.
Has there been any talk about those who need a third shot also needing a fourth shot? So right now what we have is the guidance on the third dose for those who are immunocompromised. I have not seen additional guidance on needing a fourth vaccine at this time, but I'm sure that guidance will come from the federal government if it is deemed to be necessary based on their trials.
That's so helpful. Are there any other questions or comments?
Really quickly, if I could do like a quick holiday reminder, Shula, if that's okay.
Absolutely.
Great. We will be having some additional holiday guidance, coming out. I think what folks really need to know right now is deadline reminders for vaccines. It is now, the deadline has passed to be fully vaccinated for Hanukkah and Thanksgiving, of course, but to be fully vaccinated by Kwanzaa, people need to get Pfizer by November 21st or J&J by December 12th. And for Christmas, people need to get Pfizer by November 20th or J&J by December 11th. So if you're tracking those things and people in your lives are excited to gather for the holidays, please, please, please encourage them to get vaccinated and be fully vaccinated before holiday gatherings.
That's great. I think I've also noticed too that the Times Square celebration is on, although there's always a conventional wisdom how many New Yorkers are actually there during the Times Square celebration. But I'm sure that will be part of your timeline as well for people to be fully vaccinated, if they would like to celebrate seeing the ball drop in person.
Yeah, that's a great addition. Julia, we'll have to add that for tomorrow's update. I completely forgot to add the Times Square. Yes, because there is a vaccine mandate for those who want to participate in the Times Square event. So yes, thank you. I think my last reminder is that we are, of course, it's the time to remain vigilant. We're moving more indoors right now and indoor activities, and, just reminding everyone that unfortunately we still need to be good about masks and other COVID precautions, getting tested before and after gatherings, things like that. So please, please, please keep that in mind and help us spread the word that we're not out of this just yet.
Thank you so much, Chelsea. Our final speaker actually just updated us that he was trying to multitask by being in a conference and also speaking. Was John Gallagher, who is one of our office's appointees to Community Education Council 6. So we're going to reschedule him for the next week. So we'll be having an early dismissal this day, unless there's any other questions or issues that anyone wanted to raise in the meantime. Gone. All right. Thank you so much again on behalf of Gail and Jessica and everyone in our office for joining us. And also thank you again to our guests, Dr. Lim, Brad, thanks again. And also Chelsea and Laura for giving us updates on these really exciting and really innovative, huge wartime efforts to really get everyone back to, what I think is hopefully the new hope and a new normal. So thank you so much again for joining us, and we'll see you next Tuesday. Thank you again.